Hello, and welcome to COVID-19 Right Now from the Yale School of Public Health. I am James Hamblin. I am a lecturer in health policy, and I am joined today by Kaveh Khoshnood. He's an associate professor of epidemiology and the program co-director for global ethics at Yale Institute for Global Health. Among many other interests and accomplishments, he works in and studying humanitarian efforts, and those have been widely affected by the pandemic. And I have a lot of questions for him about how this is changing the landscape of humanitarian work. And I should note this is the first of a two-part series. Next week, we're also going to be talking about humanitarianism with Uni Kurunakara, and we'll have a different perspective then. Right now, we're taking a little bit more of an academic perspective. Thank you so much for joining us today. And finally, if anyone is watching live and has questions about the subject, please drop them in the comments and we will do our best to address them. So that said, thank you so much for joining us today, Kaveh.
My pleasure.
Can we start at the top about how you come to this area of focus within academia?
Sure. So I was trained at Yale in infectious disease epidemiology and had, I would say, almost an exclusive focus on the HIV/AIDS pandemic for about 2 decades. That's what I worked on. And I worked on in New Haven, I worked on in Russia, China, parts of the Middle East. That was really my entire focus. The interest in humanitarian work is actually quite personal. I was born in Iran, and when I was a young child, Iranian Revolution happened. Right after that, there was the Iran-Iraq War. I was too young to be asked to sort of join the military, and I left the country, but I saw the beginnings of how devastating a war is, and try to forget about it. But you know, as the crisis happened in Syria, Yemen, Afghanistan, it frankly brought me back to those early days. And I was thinking, you know, we are at the School of Public Health with an entire focus on prevention. But when it comes to issues of conflict, displacement, what are we doing? What's our role? What do we bring to the table? And that really captured my imagination a few years ago, and that's how I got interested in this.
And so these are perennial issues for public health. There is always conflict, there is always displacement. Now we have this added variable of a pandemic unfolding, which has different issues for every country. But I'm wondering if you can maybe give a few kind of examples of what are some of the projects that really need work in terms of refugees and forcibly displaced populations, especially now because of COVID-19.
Right. I mean, as you said, humanitarian, when we think of humanitarian emergencies, it's kind of a broad term. And typically it's divided into sort of natural disasters. Then there's man-made, and that's conflict, war, etc. And then complex humanitarian emergencies, usually a combination of the two. So that's its own field. Some schools of public health are actually developing an entire program that devoted to humanitarian emergencies, given that the unique expertise that are needed to do that. So pandemics definitely are a humanitarian emergency. It gets really complicated when a pandemic occurs in places that are already impacted by ongoing conflict, right? So their health system has already been destroyed, collapsed, healthcare workers have been killed or had to leave the country. I'm thinking of a place like Syria. My work has mostly focused in Lebanon for the last couple of years, and which hosts a large number of displaced Syrians. And it just adds another layers and layers of complexity to dealing with the pandemic situation, because of the fact that your infrastructure, health infrastructure, has been so badly affected. And also the displaced populations have a whole range of issues, concerns, living issues that makes it really hard to deal with a pandemic like COVID-19.
Right. Are there issues with, I'm sure there are all kinds of issues about resource allocation and how to, decide, there's so much need in the world, how to decide where to focus energies and finances. And does it become especially difficult when I feel like in much of the United States, at least, many people are worried about themselves right now, either economically or health-wise or both. And does that factor into some of the challenges in working with populations when everyone is feeling sort of like there's not a lot of extra energy to focus on anyone but my immediate environment?
So there's a lot in that question. One is the issue that no country in the world seems to have been well prepared to deal with this kind of a pandemic. Low middle income countries we always think about, but even wealthy countries such as United States and many of the European countries, they were truly unprepared to deal with this. We can see the response. I've been very involved in global health work, and in global health, we often emphasize capacity strengthening to work with low middle income countries that have limited resources and help them strengthen their capacity to deal with outbreaks such as this. So they don't have to wait for weeks and weeks before they can do laboratory tests, for example, things like that. Again, this pandemic has sort of changed that dynamic because even US-based institutions have not been prepared. So there's even more urgency to focus more on preparedness. Response is extremely costly and not effective. We shouldn't have to wait for outbreaks such as this to erupt before we respond. We should be preparing. So that's a huge issue. You also brought up another, I think, comment within your question, which is often in situations like COVID-19 or Ebola epidemic, a lot of the resources get immediately redirected to that particular health issue and concern. And what that means is some of the sort of routine health services get ignored. Non-communicable disease, especially, most of these outbreaks, of course, we're talking about infectious diseases. So when Ebola happens, the money gets redirected to Ebola response, and cancer, non-communicable diseases, hypertension, diabetes, heart problems, etc., get overlooked. Even some of the other infectious diseases that are not considered, active outbreak get ignored. And so the indirect consequences are sometimes even far, far greater. And I know we're all devastated by the number of mortalities due to COVID-19, but it is quite likely that months from now, a year from now, when we look back and we look at some of the mortality data, we will find that there are more people who died of causes other than COVID-19. Mm-hmm. One of the examples I'm very concerned about, and I've been working with one of my colleagues in Somalia, is vaccination coverage has plummeted because of COVID-19. Again, a lot of the resources and attentions go into this one problem. But what about vaccination of children against measles and polio, etc.? That's gone down significantly, and that's going to have a consequence.
Right. Yeah, I understand it's not like any global health organization or any country has some huge pool of money sitting around saying, oh, we weren't using this, and now that we have this new problem, we'll go ahead and use it. It's kind of, the money needs to come from somewhere, and those are surely impossible decisions to make. Um, I'm sure there's no right answer as to how to decide to, say, move money away from vaccinating kids for other diseases and toward treating people with COVID-19, but are there any kind of guiding principles or schools of thought as to how those impossible decisions get made in
Yeah,
times like this?
that's an excellent question. It's one of the many ethical challenges, I would say, in context of a pandemic, in terms of how to prioritize your limited resources. Clearly, you should not be ignoring people with cancer just because, and you know, COVID-19 has struck. You need to figure out a way to continue to provide healthcare. But I know that every country is making these really tough decisions. WHO and others are trying to come up with some guidelines, but frankly, it's all local response. There are difficult decisions being made. There's no doubt that, well, I know for a fact that children are not getting vaccinated in many countries, including the United States. Some of that has to do with social distancing issues. In a lot of the countries, vaccination programs are big campaigns. You ask parents to bring their children, hundreds, thousands, to get vaccinated. That's not feasible. So there are also like real logistical challenges to do. It's not just resources, it's just you don't want to add additional risk to those parents and children and healthcare workers, frankly. So it's raising a whole range of issues, and I think it's emphasizing more and more how, as schools of public health, we need to add another layers of competencies around health emergencies, which frankly, not all the schools of public health have that. Some schools of public health have developed an entire concentration or a track, a certificate program to add those competencies that are unique to health emergencies. And I feel like that needs to be expanded, frankly, across all schools of public health. I don't think we can no longer ignore those unique competencies that are needed.
Right. Yeah, those ethical questions. I think when you come out of training in public health or medicine, you sort of think, oh, I know the answers and I know all the things that need to be done, and then in the real world, it comes down to prioritizing and choosing and making impossible decisions and seeing how all of those have consequences. There's a popular line of discussion in the national discourse about sort of the consequences of shutting down, the consequences of social distancing, either economically or because people are developing depression. And what's not talked about so much is these other health consequences of the disease itself that are getting worse because we need to allocate resources when people don't social distance, because the whole healthcare system has to suddenly really prioritize COVID-19 and other conditions get worse. I'm getting a little off the track there, but I think it's like that seems to be one of these unique challenges of COVID-19 that we've dealt with other pandemics before, but
Right.
this is uniquely challenging in these humanitarian settings.
But I must say that some countries are getting quite innovative, including some low middle income countries, in terms of, in context of a pandemic and social distancing, all the things you just said, how can you continue to provide health services to people who have chronic conditions? In fact, we are working with colleagues in Sudan who are coming up with very sort of innovative M-Health, sort of mobile health platforms to provide NCD care, continue to provide NCD care to those people who are quarantined. So they're able to access through their WhatsApps on mobile phone or their apps and connect with physician consultants and basically try to get some support sort of virtually, if you will, So many countries are figuring this stuff out. And so we're learning a lot. And by the way, on that note, I feel like that's another very, very unique role for academic community, is to help document those lessons learned. Every time we have some sort of a crisis like this, we learn so many things, whether it's Ebola or it's COVID-19, we learn a lot. But to document them and to make sure the next time an outbreak like this happens, we don't repeat some of the same mistakes is crucial. Right. And a lot of the humanitarian agencies, frankly, don't have the bandwidth, they don't have the energy, the time, and sometimes the skills needed to do careful documentation of what are the lessons they're learning from this response. And here's where we come in. We as academic institutions ought to partner with these humanitarian agencies and help them document lessons learned and put it out in the public, so we don't continue to sort of repeat some of the mistakes. I mean, look at the countries that went through SARS and MERS. They're doing a better jobs. If they're able to kind of draw from the lessons that they learned from those other epidemics, they do a much better job dealing with it.
Right.
So anyway, that's one role I see for academic communities, to kind of help document and develop evidence for sort of future responses.
Can we drill down on that a bit? Are there lessons right now that you've already seen in certain places that you think, public health audience watching this right now should be aware of, at least, even if it doesn't necessarily apply everywhere, but innovations you're seeing that are simple and possibly scalable?
Well, first of all, the fact that we were completely unprepared, that is a huge lesson. And what is it going to take to make sure we prepare for the next one better? We ought to be doing that. We've talked about this, but we haven't actually done it. No country has done that. So yeah, I feel like we're also learning about inequities. We are learning that people who are vulnerable because they don't have access to healthcare or have a hard time earning a living or access to basic needs. I'm thinking of some of the refugees and displaced population who literally don't have access to even clean water and soap.
Right.
And social distancing for them is a luxury that they can't, there are 10 individuals in a small tent. The idea of social distancing just doesn't work. Right. So we are learning we have to be, well, if you take that sort of the big picture is humanitarian crises require far more attention than they're getting, frankly, in terms of resources. There are humanitarian organizations who respond to emergencies, but often what happens is they work in parallel with the host country. And one of the things we are learning is that that's not really an effective model. That when a humanitarian agency responds, ideally this should be well integrated with the host country. Yeah. That's a far more effective way to deal with these situations than if there's parallel. So we are learning a ton. Again, I feel like as academic community, we should be carefully documenting all this. One of the things that I came up with a few weeks ago, and I'm working with 3 wonderful public health students on this, is a pandemic course, which is sort of a open source type of like a Coursera online course. So we can document carefully everything we're learning about this particular pandemic and put it out in the public. Make it freely available so that everybody has access to it.
Right. So you're learning things like that humanitarian organizations need to be integrated with governments. And that, I imagine that should start earlier. That means you're basically not coming into a place after the emergency starts. That means you're building long-standing relationships, having people on the ground who, even if they're not local to the area, they understand all the cultural differences and everything that would make any emergency response much more effective when it needs to kick in. Is that right?
That is right. That is, and frankly, some of the humanitarian organizations are very, very mindful of this. They strongly team up with the local ministries of health, local humanitarian organizations. They hire, majority of their staff are locals. They may bring some outside experts, but they rely heavily on the locals because that's much more effective way to respond to situations like this. There's often a lot of mistrust in the communities. So seeing foreigners coming in may not be effective.
Yeah.
So some humanitarian organizations are quite good in sort of going about this the right way, engaging with the community, as you said, long-term partnership, and not necessarily just leaving immediately after, but just making sure that whatever services they're able to provide are going to continue and be well integrated. So people are not just sort of left behind.
Yeah. Well, I have one more question for you, but if anyone has questions, we can try to address them if you leave them in the comments here. So just drawing from your own work and insights, because I think there's a human nature experience of when you feel you are threatened, either your family, your own health, your economic status, your community, local community, the human instinct is to become self-protective and say, okay, the people who I don't know don't matter so much anymore. Even if I used to do a lot of giving, charitable giving, if I used to support organizations, now I'm really much more worried about the people closest to me. And you have been through emergencies and you're seeing what's happening in the US where you're based. And a lot of people feel, the US is currently the hardest hit known country by COVID-19. How do you maintain that empathy and the motivation and the perspective that's needed to have to keep a global perspective on all the issues that are happening and to not become too inwardly or narrowly focused?
Yeah, no, that's a great question. This is a conversation that I usually have with my students in my global health class. Why should the United States care about global health? And the truth of it is that US and other health issues. So the priority is funding sort of programs that are dealing with infectious disease because there's a concern about the infectious disease coming back home and impacting US citizens. Far less attention is paid to non-communicable diseases, for example, cancer. This pandemic has reminded us over and over and over again that we are so interconnected. I mean, it's just amazing to think about a handful of cases in a market in Wuhan ended up just traveling all around the world in a matter of weeks and months. If we had any doubts that we are all connected, this pandemic reminded us over and over again. So if we don't work in partnership with other countries and don't help them deal with their local epidemic, it's gonna haunt us, it's gonna come back. I mean, we're seeing right now, I mean, countries are, controlling their own outbreak, but then it's beginning to resurface because new cases are coming in from other countries. So over and over, we're being reminded you can't just do this alone. You need to partner with other organizations. This is the time, and I hope US changes its policy of trying to actually withdraw from the international community, including the World Health Organization. This is exactly the opposite of what we should be doing. We should be strengthening the international community. And US has incredible resources and expertise to contribute to the sort of the global response.
Right. I know these are sort of issues that have been politicized by people currently in power, but in fact, as an academic, feel this is the simple fact that if there is not a globally orchestrated response, populations become more at risk. And even within the United States, states and cities have exceptionalism. You know, we watched outbreaks in China and then Italy and Iran and other places, and yet for a long time, many people in the US were thinking, oh, it's not going to come here, and if it is, it's not going to be that bad. And then even when it was bad in New York, people in Florida and Texas and other places were assuming, oh, it's only in New York and Washington, it can't come here.
Right.
I feel like, so your perspective on just understanding that it is all one community when it comes to disease.
That's the whole sort of concept of global health, that we're all in this together. This is not about us versus them. That was the notion of international health, that there is sort of our health, the health of our communities, our nation, our country, and their health. And, you know, more of a charity model that we would help them. Global health changes that concept. And if we are true to the principle of global health, we ought to care for the health of everyone, everywhere.
Right.
And
even if you only firstly care about your own community, it is in the interest of your own community.
Right.
Yeah. That you don't even have to be a good person.
That's right. I mean, there is, you know, from a sort of humanitarian moral perspective, there's a moral obligation to care about the life of everyone. But from a sort of enlightened self-interest, I would say, yeah, this pandemic has reminded us, if we can't help other countries deal with this, it's going to come back to us as well.
Right. So it seems like it should be a bipartisan agreement type issue here, no matter whether you're more on a global perspective or a self-interested perspective. That it works both ways, and yet we're struggling. It brings me to a question we do have from a viewer, which will be our last. Then I know we need to get back to important work. So when a political system is non-responsive, and we're being very general here, but say a political system were non-responsive, what alternatives can be used to promote the care needed and recommendations implemented?
Yeah, that's an excellent question. This is a time for public health to frankly take the leadership. The public health folks need to step up and be in the front line of the response. But as your the questioner asked, the political system needs to allow for that to happen. They need to allow for public health to step up and take the leadership. It becomes very challenging if they don't allow that to happen, if they restrict the public health folks to speak up. We are dealing with that, of course, in the United States. Thankfully, there's sort of freedom of press, so we can also get the voices of the public health community come to the public from other routes. But in many countries, unfortunately, because of lack of sort of freedom of press, if the government prevents public health community to speak to the public, then it becomes very challenging. And, you know, as I mentioned, I was born in Iran, and there's a lot of Iranian public that doesn't trust the information coming from the government, and they're constantly looking for other sorts of information to find out exactly what is going on, what do the numbers look like. So yeah, I feel like the media here has a huge role to play to make fact-based information available to the public in various ways. Of social media, it's become hugely important. Social media could be also a source of misinformation, but I think social media could be incredibly important as a source of sort of good fact-based information as well.
Yeah. Well, I know many people in the media are working hard, and it is doubly difficult when the administration is telling people that they can't trust facts from scientists or journalists. So we do have that freedom, but we are also being actively attempted to be undermined, which, you know, is clearly dangerous in this moment. I could go on about this, but we should wrap there. Thank you so much, Kaveh, for your insights and for all the work that you do. Really appreciate you coming on.
My pleasure. Take care.
And to everyone who watched, we'll be talking more about humanitarianism again next week, Thursday at noon. And thank you so much for watching.